Antimicrobial resistance, a global threat. What is antimicrobial resistance and what does it mean? Antimicrobial resistance is when organisms such as fungi, bacteria, viruses, and parasites become resistant to the medications created to combat them. These medications include antibiotics, antifungals, and antimalarials. As a result of this resistance, the medications used to combat these organisms become ineffective. Some antimicrobial resistant and most prevalent organisms include methicillin-resistant Staphylococcus aureus, or MRSA, carbapenem-resistant enterobacteria, vancomycin-resistant enterococcus, or VRE, and multi-drug-resistant Mycobacterium tuberculosis. MRSA is a type of staph infection. It can occur in many parts of the body, and anyone is susceptible to this infection. It is spread through contact with an infected person or through fomites that are carrying the bacteria. It is observed that approximately 5% of patients in hospitals in the United States carry MRSA. Symptoms of this infection include signs of an inflamed and infected area on the skin that is red, warm, painful, swollen, pus-filled, and often is associated with a fever. MRSA is resistant to all currently known beta-lactam agents such as penicillins and cephalosporins. Other antibiotics such as ciprofloxacin, levofloxacin, erythromycin, clarithromycin, and azithromycin are all not recommended as they are not optimal and can rapidly increase resistance. Carbapenem-resistant enterobacteria are gram-negative bacteria. Species include E. coli and Klebsiella and other enterobacteria which are now highly resistant to antibiotics, deeming them difficult to treat. Klebsiella pneumoniae carbapenemase and New Delhi metallobeta-lactamase are CREs that break down carbapenem medications, which make them ineffective. Carbapenem was a drug of choice to treat such infections, which is now becoming increasingly ineffective. There are very limited options to treat for these infections, which gives potential to further spread. Due to the limited treatment options, these infections have a high mortality rate. It has shown a range of 30% mortalities in patients with non-bacteremic infections to 72% in patients that have liver transplants or bloodstream infections. Those infected with CRE typically result in poor outcomes. Many of these CRE infections are found among hospital and long-term care patients, especially those who are immune-compromised, patients in intensive care units, those who are treated with mechanical ventilation, and those who are at an advanced age. These patients infected with CREs are around the world from the Americas across Europe and Asia. A problem is that there is a lack of surveillance and reporting studies done in many countries on the prevalence of these infections. Vancomycin-resistant enterococcus are resistant to the drug vancomycin, which is used to treat such infections from enterococci. Most of these infections are observed to occur in hospitals. Infections typically are in the bloodstream, wounds, or urinary tract. These bacteria are passed from one person to another. Tuberculosis is a major health threat throughout the world, especially with the emergence of multi-drug-resistant Mycobacterium tuberculosis. MDR-TB has been found in over 105 countries worldwide. In 2016, 490,000 individuals were infected with this form of TB. MDR-TB is not responsive to rifampicin or isoniazid, which are the leading treatment drugs to combat tuberculosis. In 2017, there were 600,000 cases of rifampicin-resistant TB. Resistance has also been observed in the antiretroviral treatments for HIV patients. In 2010, it was observed that approximately 7% of HIV patients in developing countries and 10 to 20% of HIV patients in developed countries have drug-resistant HIV. With increasing treatment regimens comes increasing costs. The impact of the effective antimicrobial resistance are felt across the world. The inability to treat such organisms can lead to greater disease burdens and mortalities. Approximately 700,000 deaths each year are attributed to such infections, and this number is expected to increase to 10 million by the year 2050. Individuals with these resistant type infections experience higher healthcare costs due to prolonged treatment and hospital stays, more tests and exams, and use of greater amount of medications to try and combat the disease. The cost, due to the burden shown from antimicrobial resistance, is expected to rise to $100 trillion by 2050. Why are these microbes becoming resistant? Resistance occurs naturally in microbes, but there are several reasons for the rapid growth of these resistant organisms. These reasons include the misuse and overuse of antibiotic medications. This occurs when physicians prescribe antibiotics when they are not necessary, such as when the patient has a viral infection, but these antibiotics are ordered as a just-in-case measure. Careless diagnoses lead to this as well, when the patient does not have a full workup and antibiotics are prescribed first. It is important to first obtain an accurate diagnosis. There is also a lack of education on the proper handling of prescribed medications. Misuse of medications also occurs when patients do not complete their full course of treatment or are not taking them as directed. Antibiotics are also unnecessarily utilized in food animals. Antibiotics are widely used in the production of livestock. These drugs are used to maintain the health of these food animals and to also promote growth due to the ever-increasing demand of animal products. Antimicrobial use for these products is expected to increase by 67% by 2030. In 2010, China, the United States, Brazil, India, and Germany were shown to have the greatest usage of antibiotics in livestock. China was the largest and is estimated to consume 30% of global production of antimicrobials by the year 2030. The expansive use of antibiotics in livestock is contributing to both the prevalence and spread of resistant organisms. Here is an illustration that examines the spread of antimicrobial resistance from animals to humans. All animals carry the bacteria within their intestines, and when given antibiotics for either increased growth or preventive measures, the antibiotics will kill off most of the bacteria, but the resistant bacteria remain and are then able to multiply. These resistant bacteria are able to spread from animal food products, produce, and into the environment through waste products. Humans can then become infected with these resistant bacteria through both the environment and through contaminated food. Why is antimicrobial resistance a problem? Without effective antibiotic, antimalarial, and antifungal medications, infections and diseases that were once treatable and able to be maintained will no longer be so. The AIDS pandemic and worldwide burden of tuberculosis cannot be adequately controlled and treated without proper antiretroviral and antibiotic drugs. Routine surgeries such as cesarean sections, joint replacements, organ transplants, chemotherapy, and other treatments will become high-risk interventions. If people become ill with these resistant bacterial infections, treatment becomes difficult and limited, which is increasing hospital stays, exams, and treatments, thereby increasing costs. Ultimately, mortality rates due to these illnesses will increase drastically. Several preventive efforts have been initiated to combat the spread of antimicrobial resistance. One such program is the Global Antimicrobial Resistance Surveillance System, which was established in 2015. This system aims to support global surveillance and research in order to strengthen the evidence base on antimicrobial resistance. Important strategies in this program include increasing the knowledge and awareness regarding antimicrobial resistance, to reduce the frequency of infections worldwide, optimize the use of these medications, and to increase investment in new treatment options and other such tools and interventions. Actions of all members of society are necessary to minimize the incidence and spread of antimicrobial resistance. Behavior changes are necessary to reduce the overuse and misuse of antimicrobial medications. National action plans to contain antimicrobial resistance can be found listed on the World Health Organization website, listing various countries and their efforts. Strategies and interventions need to be focused on countries that are known to use and produce large quantities of antimicrobial agents, such as in China. China is one of the major countries of both usage and production of antimicrobial agents in healthcare and in livestock. Listed in China's National Action Plan are goals to achieve by 2020, which include launching 1 to 2 new antibacterial agents and 5 to 10 new diagnostic tools, to greater improve and optimize surveillance and educational efforts, as well as establishing an antimicrobial stewardship program in hospitals. It is imperative that countries such as China stop the use of unnecessary antibiotic use in animals for the purposes of increased growth. An advocacy group called the Union of Concerned Scientists has estimated that 24.6 million pounds of antimicrobials are used for purposes other than to treat disease, such as growth and preventive measures in farm animals, as compared to approximately 3 million pounds that are used in human healthcare. Guidelines and recommendations should be presented and enforced on antibiotic use in farm animals. It is essential to improve awareness and understanding of the threat and implications of antimicrobial resistance. To minimize the problem, there has to be a combined, unified effort from all people, governments, and stakeholders from around the world. Everyone can play a part in combating antimicrobial resistance. There are several things that people can do to help prevent the spread and expansion of these resistant organisms. One way to help is to keep good hygiene and wash hands regularly to avoid the possible spread of illnesses. Another way is through the safe handling of food products, by keeping them stored how they should be, such as in refrigerators if possible, and to wash foods before preparing them. Another way one can help to prevent the spread of antimicrobial resistance is to complete the entire prescribed amount of antibiotics so it can be fully effective, and to not pressure physicians to prescribe antibiotics for viral infections, as it will be ineffective and can then breed resistance. Drug resistance is occurring in humans, animals, and the environment. Misuse of antibiotics is putting us all at risk, affecting everyone, at every age, all around the world. Without urgent action, we are heading for a future in which infections and minor injuries could once again kill. Handle antibiotics with care.